Can you tell me about wisdom teeth, Dr. Pauling? It seems to be that wisdom teeth have a, like a root canal, it's like a really bad stigma behind it, where it's just like such a bad thing to do, and such a painful thing to do. Tell us a little bit about it. Is it really that painful? Has technology improved to a level where, no, it really isn't anymore so painful? And by the way, why do they call a wisdom tooth a wisdom tooth anyway? I mean, shoot.
So wisdom teeth are generally what we would refer to as your third molars, and they would start to grow in anywhere from 16 to 21 and above, and they can cause a lot of pain just because there's not enough room in the mouth for them to grow in, and naturally they sometimes just grow in a bad position. In terms of treatment for wisdom teeth, what they do is they take them out, and so techniques for that haven't changed a whole lot over the years, but there are more options available in terms of treatment for pain and sedation and things like that have become more common in usage and availability, and have improved a lot over the years. So in terms of getting rid of them, not much has changed, but in terms of dealing with the pain and the consciousness of it, there are a lot more options available to the patients than there used to be.
Wonderful. That's of course wonderful. So basically the person doesn't really feel anything. Now what about afterwards? The stigma has it that like you have lots of pain for a long time, but is that also kind of diminished with the better medicines which we have these days?
Yeah, they have pretty strong analgesics available, and it's going to depend on the severity of the case, of how involved the surgery to remove the wisdom teeth is. It has improved over time. One of the major concern or factors in the pain associated with and the difficulty of surgery is when the wisdom teeth are taken out. It's best to get them when the root is at a certain length, and that's when it's about 2/3 of the way formed. So that's sometimes before the tooth starts giving you issues. It's actually better to get those wisdom teeth out then, because it's easier and it's less invasive. It's best to get them before that tooth is completely formed, which can make it more complicated.
Got it. So and that's something you would be observing as a person comes to you as a 6, 7, 8, 9-year-old. You start observing it, and then you have a pretty good idea how big that monster is going to really get, and when you really have to get him out, and then go and do it, right?
That's right. Generally, it's a little older than the age range you mentioned, but we do keep an eye on that so that we can see how they're growing in and when they're around the optimal size to have them removed as easily as possible.
And so back to actually how much pain there is afterwards. So let's see where we can get that conceptual. If I get a wisdom tooth pulled today, or let's just say a 20-year-old, which probably recovers much faster than a 58-year-old, right? Just with everything, but can he go back to school next day, the day after? What's the deal?
Generally, it's a case-by-case basis. In many cases, the kids can go right back to school or work the next day. It just depends on how simple the surgery is. Everybody's wisdom teeth kind of grow in a little bit differently, so.
I got it. So at the very worst, pick a Friday, have your weekend, and you're totally fine.
Yeah, in most cases that will be perfectly fine.
Beautiful. All right. Thank you very much.
Yep.